Okay, excellent job to the rapporteurs. No rebellions from any of the three groups. So we've covered really quite a broad set of topics. You've offered many detailed recommendations or proposals for steps to move forward. What I'd like to do is open up the discussion to the full group to, of course, allow those who are in one group to comment on any of the findings of the other groups to help shape our collective thinking of what needs to happen next. I think the idea here is not only to identify steps that, for example, the forum could take, but certainly to identify steps that many of the other actors who are represented here in the room might be able to take. And we heard calls for additional research, we heard calls for additional convening, we heard calls for new policies and new funding to be put on the table, so quite a range of potential actions. I see three, so let's start here with Jay Siegel. We'll go back to the back of the room. Sorry, I'm having a little bit of a hard time seeing. 2, 3, and then 4. And please identify yourself when you begin speaking so that for the recording it's clear who's speaking. Thank you.
Thank you, Jay Siegel. Well, with regard to Group 1 and the discussion of models that Peter summarized, I think it's certainly, I deal with a lot of models, and I think it's true that there are a lot of risks to both overconfidence in models and under-acceptance of models. And communicating uncertainty is important. Communicating it simply, I think you said, I mean, you need to communicate in the way that the consumer understands it, but it depends on what you mean by simple, because what I would argue is it's not enough just to say what the uncertainty is, but an approach that's not too complex, that it really gets to the user, what a user needs, is not only, as your slide listed, to communicate the assumptions, but then to communicate sensitivity models around alterations in those assumptions. So if you identify which are the assumptions, you know, a 20% transmission rate, a logarithmic curve fit, whatever it is, what are the assumptions that are driving the model, and what happens if you shift those assumptions? Does it shift your result massively or minor within a range of reasonably plausible possibilities? I think that that's the kind of approach that builds confidence both of the modeler and of the consumer that it's a usable model.
Thanks. Let's take all 4, and then we'll come back to the panel. So we had the gentleman in the back. Thank you.
So, again, following on that, I applaud, naturally, since it means job security for me and my team, the idea of continued use of models. I think, though, there's this idea that, you know, models are going to solve everything. I think the most important part, particularly in the context of things like preparing for pandemics, responding to microbial threats, because you have such a multidisciplinary audience and such a wider range of people you want to reach, simple, obviously, is better. No black boxes. But I also think be realistic about what a model can say, particularly if you want it. Everybody comes to the table, we want the model to say this, include social interactions and utility of this, that, and the other. Simple model is not going to do all of that. It can do a lot by proxy. For example, if you want to talk about human behavior, you know, it might not model all the human behaviors, but you might have a variable there that says compliance. And that captures a lot of variables that drive human behavior. And if you can very simply change it, compliance might change over time. And that's very easy to program into a simple spreadsheet-based model. But the most important thing about models isn't actually the number that it produces. The most important part is it teaches the users and the people who ask the questions, what are the important variables? And how might changes in that change your decision space? Improved accuracy in the models does not improve policy as a general rule, because public health responses are not pinpoint accurate. They're pretty broad, so same ballpark is good enough. So this idea of better understanding what the model does and does not, and using it as a teaching tool as opposed to worrying about exactly what the model calculates, that's what the emphasis. So bottom line, you should emphasize, we want models to teach what is really important and what we really want to prioritize in terms of variables that we're going to act upon, and the other stuff is not so important. It's the teaching part, communicating with different. That is what you use models for, not this generate numbers. You're not an investment bank in Switzerland trying to make a decision down to the last half franc.
No, so I forget. Okay, is that me? In 1953, Fermi, Pasta, and Ulam. Well, actually, there is an article in the New York Times by Steve Strogas. Who said, what was the real hero of 1953? 1953, the year that Watkins and Crick discovered the chemical structure of DNA. 1953, Fermi, Pasta, and Ulam posed themselves some mathematical problem that was a large-scale problem. And Fermi, Nobel laureate in physics, Pasta, one of the establishers of computer science, Ulam, a great mathematician, and they thought they knew. But after a while, they decided to put in the computer. And they discovered that they were totally wrong, that they had no idea what was going on. At that time, a third way of doing science appears, and that's the computer experiment. So the computer is an experiment, and without those two things, the advances that we have seen in biology would have not taken place. It's not just one thing, it's both of the things. At that point, the model becomes the telescope so that you can understand the interactions between stars and galaxies or whatever. It becomes the microscope so that you can explore and understand cancer. That's what models are about. It's about understanding and getting this. It's a third way of doing science. It's not. We use some models for teaching, but it's a way of doing science. We can. Now, what is the problem with models? Is that in general we think of a model as a reflection of reality. So there are some models like that, agent-based models, different kinds of models, and we want to model these interactions, and we want to model reality. And pretty soon, it becomes as complicated or more complicated than reality, and then we don't get any understanding, and we don't know what's going on, and we get all sorts of problems. That's the problem. What there has to be is a model has to be tied into a question. And we have a lot of history of doing that in ecology. And we have a lot of history about in economy. In fact, in the 50s, people were against models in economics. Now they become pervasive. We also know that models are different. We have Elinor Ostrom that came with completely different new ideas of how to look at the world that was not reflected in the standard models. So this is the big issue. The big issue is that has to be tied. So if I don't have a question and I say, well, but we have to include age, we have to include demography, we have to include this, we're trying to mimic reality, and then suddenly we're lost. There is no model that is right, but it can help us understand a question. Particularly, it adds understanding or generates new hypotheses. Can models used for prediction? Yes, you can use models for prediction just like statistical models, and sometimes some epidemiological models are better. And sometimes when you have to make short-time decisions, that's the best way to go. So this is one of the important things like that. Models have a different purposes, but it has to have an a priori purpose. Communication, as was mentioned, is absolutely critical. But there is something that in 1911, Ronald Ross, the guy that got the second Nobel laureate in medicine, by discovering the life history of malaria, he says, well, now I understand the interaction of malaria. How can I solve this problem at the population level? And then he has an idea. You have to bring the mosquito population below a threshold. Nobody pays too much attention, so he writes some models and shows that conceptually that's actually possible. And then they believe. But he does something more. He writes all of this in an appendix. And what the math biology literature has done, not always, but Journal of Theoretical Biology, many things, they try to put the problem, the description, the solutions, and they try to put the equations in an appendix so that people can actually read it. And the conclusions become very different so that you can see what you actually learn from that model. Now, there are models can be used for public health policy and predictions, like people were talking about scenarios, doing uncertainty analysis so that you can make decisions. Those are different kinds of models, and also they are very useful. But you know, of course we don't expect to solve things for models. You know, models are as good as the people that make them, and unless we have the collaboration of groups like this, they're not going to be very effective for public policy. But they can be very useful to answer really important questions if we focus the model on the question.
Thank you very much. I think we've had a series of very wise comments regarding the uses and limits of models, but I would like to also remind us we want to come out with some very clear proposals for next steps and for action. So for the subsequent speakers, please make a clear suggestion to the room for action. And what I wanted to do was to take as many comments from the floor as you would like to offer before turning to the rapporteurs at the very end to offer some final conclusions regarding what some next steps to move forward might be. So I had the lady up front. I'm sorry, I can't quite see your name, number 4, and then Mukesh will take yours, number 5.
Hi. I have 2 suggestions. I think one is for Ed's group. The reason I asked the question yesterday about the BRICS and the vaccines is we're trying to predict what the market price or the value would be for Brazil, Russia, India, China, etc., of a new TB drug and predict that 15 years ahead, so that if this price would be set, what would it be? And just to sort of say some areas which we're getting stuck with, which might give you some thought for where we sort of need some work. It's particularly around the cost side. I know we're focusing a lot on the impact side, but what we're trying to work out is if the regimen changes, the cost of the health system change and how they react. And we don't have the cost data to be able to do that at the moment. There are efforts going on to expand that cost data, but in our models, that's the thing which is our results are highly sensitive to, not so much the drug itself is non-inferior, but it's what it's doing to those health system costs and how you can spend those monies on other areas of health improvement. And that's where the value of those drugs may lie. And that's the bit we're struggling with. The other thing is predicting the envelope for the health sector going forward into the future, so you can really understand the opportunity cost of if they buy those drugs, then what will they be foregoing? And we're having issues around that. And the other thing is the extent to which you're building, which comes back to the point yesterday, building other interventions, whether you're including what you need to do in terms of drug susceptibility testing, but also should a vaccine come in, then, and you're committed to paying a price for a TB drug, clearly the value to the Indian government is much less. So that I was a bit tired yesterday when I asked my question, but I was trying to get to those points, that those are the areas that we're really struggling with to predict that market price to back that finance system. So areas where we'd like to see more data collected or more effort spent. And coming to Anna's thing about capacity building, I just wanted to highlight that. It's almost like seconding that point. That is really important. I think we've spent 20 years trying to build capacity in health economics in low and middle income countries. We have struggled with that, and I think it's sort of to our shame that we haven't managed to do it more than we have. The challenge we're facing at the moment is, as much as we're building capacity, our methods and our models are changing. So now I would say it's not just health economics capacity we need capacity in mathematical modeling in low and middle income countries. And at the moment, most of the modeling is done back in European universities, and it will go out in user-friendly models by consultancy companies to those countries, which will undermine local capacity. So I think we really need to rethink the way that we're doing our modelling work in global health in the same way that we have done with health economics, and learn from the mistakes we've made in health economics. So like a caveat around that.
Great, thank you very much. Mukesh?
Thank you. So there are models and there are models. So at the bank, I run a facility called the Pandemic Emergency Financing Facility. What the PEF does is offer insurance to countries against outbreaks. At this point of time, we have a $500 million facility, and should there be a qualifying outbreak reaching a particular threshold level or a trigger level, the insurance triggers, money comes to me, and I hand over the money to the countries based on certain formulas and parameters which have already been discussed. The way that this works in the private sector market or in the capital markets is through modeling. Modeling the probability of the event or of the event reaching the particular threshold. Say it is 100 deaths to Lassa. So one has to figure out how to model the probability that there would be Lassa somewhere in the world in the next year. And that gets to a level of 100 deaths. And then you multiply that by the expected payout and you come to the premium then there is a loading factor. A very small difference in that, a 0.1% or a 0.1% probability difference in that for me means multiples of millions of dollars. And so that modeling precision becomes extremely important. So when we were doing this in round one of the PEF, for the Pandemic Emergency Financing Facility, we were struck with how less we know about modeling in this world. With the exception of the work that we saw in terms of modeling influenza. Dean is sitting right here, so there's a great deal of work that Dean had done. And then some of the proprietary stuff from some people around the room here. There is nothing out there. So we were struck as to how much we don't know about this world. Then coming into this greenfield territory, then translating what we don't know into a money market value is a bit of a risk. Yes, the bank is in a position to incubate that and to kind of work on that risk. But going forward, this is something that we would be extremely keen to see being more developed, to see being more socialized, and to see a number of universities and partners and thinkers around the world working on this so that we can demystify this. Just the same way as I believe by now we have demystified the calculation of probability of your next auto collision. So we have brought down that insurance to an art. But we are nowhere near that as it comes to a pandemic response. I'm not talking of preparedness, I'm speaking of response. So that is something where I think a great deal of work needs to be done, and we would be happy to collaborate with others on this in finding a supporting mechanism. I don't know what that will look like or what shape that it could be, but any advice from this forum would be extremely useful. Thank you.
Thanks very much, Mukesh. David.
In regards to Group 2's narrative, it was interesting to hear the comments get at different aspects of activation energy for drug advancement, and I heard cost, I heard patient access, I heard syndromic access, and then a little bit of a blurb regarding regulatory agencies starting to rethink this. What I've not seen generally is a really explicit analysis looking at sort of multimodal activation energy to look at impact of phase 2A/B versus 3 strategies for approval and animal rule-like use, as was discussed in the pandemic, actually assessed in a dollar value that's relevant to counterbalance incentive priorities. And you mentioned incentives. It would be very cool if folks who do that kind of analysis might think about it.
Okay, I see no further requests for the floor. So what I'm going to do, yes, sorry. Carlos.
Yeah, I want to answer to Mukesh. I think this is a very specific problem, and this is a decision-making model. And I think that in that particular way, there is all sorts of knowledge about how to build decision-making models based on of course, everyone is based on the information that he has. And this is when you use models to make decisions based on the information. That's just one kind of situation. And I think there is plenty of literature on how to do this, but for a particular project, you sort of have to build a group that builds those models to make you have those decisions. But there is plenty of literature. And similar, there are, I think in public policy, School of Public Policy, that's what you need. It's just you need to have models for make decisions based on whatever theoretical work, practical work, data that you have. So that's I think, and I think there is sometimes no differentiation and there is confusion as to what the models play role. So you're asking for recommendations, and I think that is essentially making this differentiation on the fact that people that are in public health departments, they have to make decisions all the time, is how that's getting incorporated. Many times this is done primarily with a statistical model because they have to make decisions over a short time scale. And there is, in fact, a theory to do that. And then the deterministic models, I think people have talked about, the main issues have to deal with an uncertainty. And that's complicated. The issue is there is a lot of theory that has been done, and how much does that get applied to public policy or not? That's a very different situation. I have, for example, written some models in the 80s of why influenza appears and reappears or subtypes every 20 years, and develop a theory across immunity. Well, I think that's an interesting theoretical work. How much does that help this community? Probably not. But that's still epidemiology. So there is many different reasons why you want to do that, but how to communicate it, and in fact, trying to encourage some of the main journals to actually have, not reviews that people mention everybody and who did this, that, but how models have been used to address specific questions. Right? That might be a very useful way to communicate this, because this is an eternal problem in almost all fields, that there is all sorts of models that are being used, but there is not a good assessment of how to do this.
Okay, thank you very much. I'm going to close I have a very urgent waving placard in the back. We'll take one last comment, and then I'm going to turn to each of the chairs in the order in which they presented for final conclusions. Based on what you've heard, what are the next steps for action? So last comment from the floor, thank you.
Thank you. I'm Nita Madhav from Metabiota. I wanted to respond to Mukesh's comments on doing more of these frequency and severity types of analyses. I think there are a few things to consider here. One of them is that that type of analysis is a lot easier to do when you actually have data to inform it. And for events that happen with a high frequency, I think those data sets often exist, especially in well-resourced areas. And so I think it would be wonderful to see more of those types of analytics done. I think where we run into issues trying to do these analytics is in the low frequency, high consequence events. And for influenza, I think the data is pretty well characterized in the frequency of these events, and we have a rich historical data set to look at. But if you're looking at something like novel coronaviruses, where there's only been 2 events in the past 15 years, I think these models are necessarily going to rely on assumptions, and to answer the questions that are posed, we need to make these assumptions and kind of do the best we can with the data we have.
Great, thank you very much. So Peter, I'll turn to you first. Next steps and action.
Right. Yeah. No. So this is a really interesting discussion, and I think a lot of things were common to that last group that talked, and one of them goes back to Jay's comments. That the modelling community, you almost want to be working with the customer, and in a way that you can adapt and move and then reassess and move and go back in and refine, bring new data, and end up with a reasonable answer to the key question that was asked. So this goes back to all of these things that were said around the table. We need proxies for behaviour. I think that's a really interesting point about compliance as a proxy. But we don't necessarily need simple models. We need models that address the very specific question that's asked. And the problem that I see around the room is that who's doing this work? It's usually academics who are tinkering and having an interesting question, their own question that may not be the question that the ultimate end user of that model actually has. And then you've got a problem because you've got to explain to the end user who wants to make all sorts of decisions based on a model that may not be appropriate. This needs to be a compromise between both groups, both the people who actually use them and the people who are making them. And it gets to Mukesh's point and the point from the Metabiota group who are working with insurance. Now, you have an insurance facility, pandemic emergency financing facilities. People call it insurance. It's a very different thing to a company that's going to sell insurance and try and make a market out of that. And I think that understanding risk is important to both sides, but there are differences in that. I agree completely with the last point. The problem is data, our data. The data, these are sporadic events that are rare, that are poorly analysed. This goes back to issues around when a disease emerges. It's rare that we actually go into that in depth to find out why it emerged, what the driver was, where it started, and what the trigger for that to happen was, and then what the triggers for each step of a disease to spill over, to spread regionally, then nationally, then internationally. Each of those has different parameters. The very rare ones are the ones that have a big impact and spread internationally, but there's a lot that can be learned from individual spillover events, which are far more common, far less understood, but ultimately doable. So I think one of the next steps is for groups to go out there and gather data in these countries where diseases emerge and start that then become pandemic. And that's not to say other countries, the othering of this idea. This is also here in the US, foodborne infections, drug resistance. Where do drug-resistant strains originate? That's poorly understood. If we're truly going to deal with these issues on a big scale, we need to allocate resources accordingly. So there really needs to be a strong emphasis on gathering data to support the modelling. These are the next steps, and those are data on individual spillover events that then lead to different scales of outbreaks. Gathering data from behavioural social sciences that can be generalised through various clever and intuitive proxies, using the appropriate model for the appropriate customer and working with the customer. So those customers need to actually engage the modelers. It's one thing to say in the room you'd like to work with those models. We now need to see an RFP to bring those modelers to do work specific to those questions. And then finally, to really take this to the next level, we need to communicate those models in a much more appropriate way, and that changes depending on the customer. If the customer is the US government around global health security, or it's the Indian government around the Nipah virus outbreak that just happened, or it's the insurance companies around their risk needs for proprietary purposes, or drug company that's designing drugs that wants to make the most profit by allocating to the appropriate countries.
Thank you very much. Very action-oriented. Ed, action and next steps.
Thank you. So thank you for the piece of feedback. I think in terms of next steps, industry has talked about continue to generate and refine the consensus they have. I hope that happens, and I hope that is as public as possible. I'm sure it will be. In doing that, the more that industry colleagues can think in terms of the decision makers that will then spend the money that they want and the decisions that they will take. I mean, what is interesting is that you in industry make portfolio decisions that are not, in a way, dissimilar to the decisions that payers and health systems make. So I know you're doing it, but keep trying to put yourself in those shoes as you're doing that and give them the tools to balance up what are competitive decisions that all involve patients who are sick in some way or may be sick in the future. So that's one thing that I hope will happen next, and we're told will. I think I can only talk for Wellcome Trust in terms of what we might do next. We're looking at whether we will support more analysis that helps to sort of thrash out some of those choices that decision makers will have to make and bring that to a more granular level. Anna, thank you for some incredibly helpful and much more pragmatic suggestions about how one might do that and the angles one might look at. David, I think I understood the point you made, but I'm not an expert on anything, so I'd like to come and talk to you about that to make sure that I have. But that is certainly something. I think the next step also is bringing out more information on what is happening and what we're trying to do, particularly on stewardship and access. We, from Wellcome's point of view, are using CARB-X a little bit, so those 30 or so projects that are being funded will have themselves stewardship and access plans attached to them. And I think the sort of growing, hopefully, literature and the growing community of practice around what stewardship looks like is going to be a really important part of how we sort of get to a new answer about the economic case, the reimbursement case, and the sort of overall procurement case for antibiotics in the future. I'm afraid I don't have anything more specific than that because I don't want to commit anyone else around the table, but I hope we've got a few ideas that we can all sort of, threads that we can all pull on in future.
Great. Thank you, Ed. Last but not least, Adams.
Thank you, Suri. So, I think a lot of the actions and next steps that relates to our area are common to some of the things that Ed and Peter have just discussed. Actually, I was really struck during the discussion that we've been having. One way of looking at much of the back and forth around models was, models for what purpose? Models to influence decisions or models to think about predicting probabilities? And the need to focus on the decision-making function that models serve seems really, really important. So, one of our clear next steps definitely for those of us interested in the economic impacts piece, is to get to understand our customers better. Actually, this was a point that was raised by Jessica Krause in our group, that actually we don't know very much about how decision makers who are allocating resources around sort of public health and preparedness plans think about preparedness. And if I don't understand sort of what inputs you use, or your process of decision making, how am I going to produce any kind of an analysis which will influence that? So there's clearly some work that needs to be done on that, the sociology of the decision making relevant to this area. Data, also clearly an issue. And we're beginning to see sort of more efforts to collect this micro-level data of sort of local-level impacts, which allows us to make a better economic case. But thinking about how can we leverage existing sources better, how can we pull together existing data sets, seems like an obvious win here. The bank sits on a huge wealth of really good, highly granular information, but that we could probably do a little bit better job of curating. And so I'm hoping that we might be able to start some discussions with some volunteers after this session to think about what can we do to pull that data out so it's more available to teams that are going to try and do this local level analysis in future. We had a couple of sort of very clear suggestions on specific analyses that we could do, and I'd be really interested again in having discussions to take these forward further. The first one being around that incremental cost on top of existing global health expenditure that's relevant to global health security, trying to figure out exactly how much more would it take to upgrade existing programs so that they begin to cover some of these pandemic preparedness priorities. And actually thinking about that across sectors as well, so around animal health and sort of agricultural system strengthening programs. The other clear sort of analytic suggestion that was made was actually some analysis on the relationships between some of these investment and trade outcomes and disease activity. It's a thing that I think is credible to all of us. We all have a sense that that's probably a causal relationship, but there isn't strong empirics around that, and we could do something better to do that. The last set of actions actually really about capacity building, and again, Anna, thank you so much for a really helpful and thoughtful comment. There is a real risk that if we start trying to build out the capacity that we think we need today, by the time we get that capacity built many years in the future, it's no longer relevant. And I think there is probably a very discrete and tangible piece of work we could do about trying to say, look, well, what's the capacity that we think we need to develop? Where do we need to develop? What's that physically look like in terms of professionals, in terms of support structures? And then, right, how can we get partnerships going that build this in and integrate this into existing sort of system strengthening activity? I think the last thing that we need is another program for more health economics or computational data scientists just for pandemic security. We need to figure out how to mainstream this stuff into existing development activity.
Excellent. Thank you so much. I think my panelists have done a terrific job of synthesizing and putting forward next steps and ideas for action. I was asked to try to synthesize at a very high level some takeaways and major themes that emerged. So I'm going to try to do that in about 60 to 120 seconds. And what I'd like to do is to bring us back to the original question, I think, that motivated many of us to come to this room, which is, how can we be more effective in managing the threats that are posed by microbes, by microbial threats? And what is the role of economic analysis broadly, whether it's models or other types of analysis? What is the role of economic analysis in fact, helping us to do that? And in terms of major themes, I'd like to group them under three broad categories: research, convening, and policy. And under research, I think the major themes were that we need to move from the broad to the specific and targeted, and that we've had good research and estimates and models done of some of the very global level impacts, but what we need is much more targeted policy relevant work. And it needs to be convincing, of course, and relevant to policymakers. And it can also be used actually as an accountability tool to measure what's been put in place, have actions been taken that responsible parties said would be taken. So economic analysis can play a number of different roles. I think two key questions that came up were: who participates in providing this kind of economic analysis? Is there a need to broaden that group of people? And secondly, how can we make the theme of communication, I think, is very key, whether that's communication among and between researchers. There isn't probably one conference where everybody comes together and exchanges these types of analyses, or whether that's communication more broadly to the broader policy community. So the second major theme after research is convening, and I think there was a real call for, in a number of comments, there needs to be, again, convening, whether of the research community, of the policy community, community to tackle some of these issues and to make decisions and to move. And certainly in the subgroup that I was involved in, there was a real feeling of urgency that there's a lot of analysis out there, but at a certain point you need to decide and move. And that leads me to my last category, which is in terms of policy change, putting money on the table, actually making an impact out in the world. The utility, of course, of economic analysis, but the need to engage in that kind of analysis both inside and outside the health sector in order to affect policy change, and to do that both inside and outside academic or policy silos to really, in fact, improve our global capacity to manage microbial threats. So on that note, I will hand over to the two Peters to close the workshop. Please join me in thanking my panel.